There are many ways to lower the HbA1c levels.
The first and the best way to avoid glucose spikes is to make sure that you take your anti-diabetic medication, be it tablets or insulin, regularly without missing a dose.
Avoid foods which have high glycemic indices, which means foods that shoot your sugar levels very rapidly. These are breads, pastas, direct sugars, and carbonated drinks. The other important thing is include a lot of fiber in the diet in the form of vegetables, legumes, whole grains, because more the fiber in the diet, slower is the sugar absorption, the glucose absorption, and this avoids high glucose spikes. The other weapon to lower your HbA1c levels is exercise. Exercise will increase the body's sensitivity to insulin, because in type 2 diabetes we have insulin resistance. So exercise, by increasing the insulin sensitivity, will allow the cells in the body, the muscles and so on, to use the available glucose from the bloodstream, and thus helps in decreasing blood glucose levels and thus decreasing the HbA1c levels. The other important thing is include a lot of fiber in the diet. More the fiber in the diet, slower is the sugar absorption. When we have a meal, the glucose from the intestine will be absorbed into the bloodstream, and this is how we get our energy. When we have a meal rich in carbohydrates, the amount of glucose absorbed will be very much, and also it will be at a rapid rate. This leads to a glucose spike in the blood, which is not good for the health. But if we have vegetables which are very high in fiber to start with, then these fibers form a mesh coating the intestine. After this high fiber diet, when we take carbs, that is a carbohydrate rich diet, then this mesh around the intestine will not allow the glucose to be absorbed rapidly, which means it slows down the absorption of glucose into the blood. This will avoid glucose spikes and thus protect our organs. Another way of avoiding glucose spikes is by taking apple cider vinegar around 20 to 25 minutes before your meal. The acetic acid in the vinegar, it slows the glucose absorption and thus decreases glucose spikes. The acetic acid in the vinegar also enhances the absorption of glucose in the muscle and thus helps in avoiding glucose spikes. If regular anti-diabetic medicines as well as insulin are not able to bring your sugars under control and not able to lower your HbA1c levels, then metabolic surgery could be a very good option. Metabolic surgery is a keyhole laparoscopic surgery done on the stomach and the small intestine in type 2 diabetics in order to reverse diabetes. Metabolic surgery sets an auto system of hormonal interplay in the body, due to which anti-diabetic medications and or insulin may not be required to maintain normal blood sugar levels in a diabetic patient.